Hello, I'm Carrie Machito, nurse practitioner and injector here at DTRN. I would like to personally welcome you to our full face rejuvenation event featuring Juvéderm. We'll be doing a live Q&A at the end of the presentation where I personally will be available to answer any questions you may have regarding the Juvéderm line of fillers. Additionally, we'll be doing a giveaway during today's event, including an HA5 hydrocollagen, a $250 DTRN gift card, and a free lip filler treatment. Winners will be announced by email in the coming days. We have some event specials as well that are available today and through the end of the month. They include $75 off of any package including Botox and a single syringe of Juvéderm, $200 off of any package including 2 syringes of Juvéderm, and $400 off of any package including 3 or more syringes of Juvéderm. Juvéderm is a line of hyaluronic acid fillers. Hyaluronic acid is a naturally occurring substance in our bodies that holds on to water. When you inject an HA filler, it plumps the skin, restores volume, and smooths out lines. Since hyaluronic acid is a naturally occurring substance, the potential for allergic reactions is low. The Juvéderm fillers consist of various different products that vary in consistency. This can be used to tailor a treatment to the patient's needs and customize for what they're looking for. The fillers contain lidocaine, which improves comfort during the treatment. Additionally, there's an enzyme called hyaluronidase that can reverse the effects of Juvéderm fillers and remove them in the event of any complications. Our bodies also produce this enzyme, and these fillers dissolve gradually over time. Generally, Juvéderm fillers are expected to last between 6 months and up to 2 years. Juvéderm has 2 different manufacturing technologies. Hyalacross technology is their original product line. It consists of Ultra and Ultra Plus. Ultra is a nice soft filler. It's used for moderate to severe lines, and Ultra Plus is a little bit more robust product. They can last up to 1 year. They work lovely for deeper lines like the nasolabial folds as well as lip filler. And then their newer product line is called Bicross technology, which includes these ones. Bicross technology links HA particles of different sizes to provide improved smoothness and durability. The products within this line include Volbella, which is a soft, natural product that works really well for lip augmentation as well as smoothing the perioral lines and the under eye hollows. It's approved by the FDA in all of those areas. Volbella can last up to 1 year. Velour is a product that works well for moderate to severe lines. It's approved for the nasolabial folds and can last up to 1 year, has a very natural, smooth outcome. And then Voluma and Volux are designed to be injected more deeply. They're to help with contouring and structural reinforcement. Voluma is approved for injection in the temples, the cheeks, and the chin area. Can last up to 2 years in those areas. Volux is also a firm product. It's a little firmer than Voluma even, and is approved for injection along the jawline and chin for contouring in that area. It can last up to 1 year or more. Common areas where HA fillers are used include the lips for lip augmentation, the nasolabial folds for softening of the nasolabial folds, the chin and prejowl sulcus, as well as the jawline for contouring, the cheeks for contouring, the temples, which also helps provide lift and support for the facial tissue, and also to blend and contour through the chin area. At DTRN, our expert injectors can help tailor a treatment plan to your needs. They've all had extensive training in the entire Juvéderm product line and can make suggestions to optimize your outcome. Safety is our top priority. All of our injectors have had extensive training in how to provide these procedures in the safest way possible. We also have access to a bedside ultrasound, which can be utilized for higher risk areas to minimize the risk associated with these procedures. We are a participating ALI provider, so you're able to use your ALI benefits here in our office, and one of the industry leaders here in Texas. Thank you for attending our virtual facial rejuvenation event. I will be available for the next 15 to 20 minutes to answer questions online via our live Q&A. If you have any questions, feel free to enter them into the questions box. We'll be sending out text messages at conclusion of the event. If you would like to schedule a visit to take advantage of our specials through the end of September, please reach out and we can get that arranged. And finally, as a reminder, we are doing the giveaway, including a SkinMedica HA5 Hydrocollagen, a DTRN $250 gift card, and a complimentary lip filler treatment. We'll be reaching out to winners via email over the next few days. Thank you. Hi everyone. So I'm here to answer any questions that you may have. If you have any questions, please feel free to put them into the question box. Let's take a look here. So I have some questions about what should I do to prepare for the treatment to get maximum benefits. So always, coming in good health, well hydrated. You want to avoid coming in when you have any vaccines planned or anything like that. You should avoid using retinol, Retin-A for a few days beforehand. Avoid anything that's going to thin the blood and potentially increase your potential for bruising, such as aspirin, non-steroidal anti-inflammatories like ibuprofen, those types of medications. And then if you know that you're prone to bruising, have skin where bruises tend to be very visible, you could potentially take some arnica montana starting the day before your treatment as well. Let me take a look here. I have another question about how long the swelling will take to subside. Usually the first 2 to 3 days are the most dramatic for swelling. It varies from person to person as far as how long it takes to subside. But usually 2 to 3 days, you'll start to see things going down. And then usually by 1 to 2 weeks, it's minimally noticeable. There's still a very small amount of lingering swelling at that point that resolves over about a month after the treatment. But that's usually not noticeable. Another question, can you use any of these fillers for the under eye? Juvéderm has approval for under eye treatment with Volbella. It's one of their Bicross technology products. It's a very soft product. It has a low propensity to absorb water to itself compared to some of the other ones. So that is one that's approved for that area. But we usually start with the cheek area to provide some structural support prior to treating the under eyes to minimize the amount that we need in the under eyes and thereby the problems that can be associated with treatment in this area. And then I have another question. What do you recommend for crepiness for under eyes? So crepiness is actually a feature of thinning of the skin, which that's an area on the face where the skin is the thinnest. And dermal fillers are really usually contraindicated in patients that have crepey skin. It can make the crepiness worse. You're a little bit more prone to get some swelling and those kinds of issues after having any sort of HAs injected into that area. There is a
there's several different products that you can inject into that area, just not the HA fillers. They don't tend to be great for crepiness. There's a product that we are starting to work with that is platelet-derived growth factors, and that can help with some collagen stimulation, improvement in the skin quality, especially paired with some of our energy-based treatments. And then I have another question about how much is this? It depends on the treatment, of course. Our fillers are priced from $550 to $780 for the Juvéderm fillers. Depending on what area we're treating, sometimes one syringe can provide some improvement. Sometimes it may require a little bit more than that. You're always welcome to schedule a consultation. We provide free consultations, and we can give you recommendations based on how you present. And then I have another question. I have a question about lip filler. How long before it evens out? It is not uncommon with lip filler for the product to be lumpy and bumpy. That can take about a month for the product to hydrate and soften. So I would say, give that maybe a little bit more time. And then if you have any questions, you can always schedule a visit to come in and have us take a look. And then another question, does it depend on how much you move your face for how long cheek treatment lasts? No, it does not depend on how you move your face. However, if you sleep on your side, that does contribute to the product breaking down. The way you move your face is not really going to play a role in that. And then another question, I have lip filler. Do I have to get it dissolved before getting a touch-up on my lips? Not always. Oftentimes with lip filler, once you have it injected, people will come back periodically, typically once a year, once everything is at the place that they want it to be at, and they can just touch it up. Oftentimes people get to where there's still quite a bit of remaining filler in the lips, and they can transition to a softer product that is going to have a little less potential for migration outside of the lips. If there is a lot of migration outside of the lips, that's the point where it may be worthwhile considering dissolving the lip filler before adding more. Let's see here. Any after treatment recommendations? So if there's swelling, pain, bruising, certainly ice can be helpful to get through the first several days. You want to avoid anything really strenuous where you're increasing your blood flow, which can increase swelling, of course. You want to stay out of the sun. When your skin's irritated, the potential for hyperpigmentation is going to be a little bit higher. Avoid salty food and anything that can increase bruising, such as like aspirin and ibuprofen. And then what's the best product to use on the lips after lip filler treatment? So for the first day or two, you should avoid any sort of pigmented products. You want to use a clean, new, hydrating occlusive, like you can use Vaseline or Aquaphor. And then after that, if you want to use lipstick, you can certainly do that. That can cover up any sort of bruises. And then a hydrating lip product is always helpful as well. And then I have another question. Let's see here. Is it okay to mix the different types of Juvéderm? And yes, you can mix the different types of products. You can actually mix Juvéderm with other hyaluronic acid products, as well as with different biostimulatory fillers like Radius and Sculptra. Oftentimes you don't want to do them in the same area at the same layer on the same day, but you could potentially do treatment in the lips on one day with hyaluronic acid filler and a biostimulator in the cheeks. They just need to be in separate zones of the face. And then I have another question about smile lines. Juvéderm can certainly be helpful for smile lines. It depends on what exactly is going on. Sometimes some filler back along the cheekbone to provide some support as we lose support along the zygomatic arch as we get older. Restoring some of the support can help improve this area, and then finishing that off and kind of touching up with a little bit of Juvéderm into the nasolabial folds can be very helpful. And then I have another question about whether there's a lot of migration with this type of filler. Migration is an issue that is largely related to the amount of filler that's placed into an area. There's really not one HA filler that's more prone to migrating than others. It's really more about the amount that was placed into the area and perhaps the technique that was used. There can be migration with any of the HA fillers if you have enough of them. I think the most common area to see problems is the lips, and it's oftentimes just related to overfilling and sometimes a little bit with technique. And then what is the downtime? So as far as downtime, you will have swelling for the first few days. In areas where there's like the lips and around the eyes, that tends to be the most dramatic when you get treated in those areas. The cheeks, because of the size of the area, any sort of swelling that you have tends to be fairly minimal and not super noticeable. You are able to go about your day and do things. You just can't wear makeup for 24 hours. So it really is going to be very personal as to whether you feel like you need to work from home or something of that sort. And then I have another question about fillers in the cheek, chin, jawline. Regarding a prior treatment, I would just recommend that you speak with your provider regarding that. And then I have a question about from someone about if they've never had Botox before, if they can get Botox and fillers in the same session, and how soon will they see effects. So with Botox, it takes a few days to start to see any changes, and then a couple weeks to really see the full effect of the treatment. They can be done on the same day. It just, if you're treating one area with both products, the injector will need to plan out what they do first, essentially, but they can definitely both be done on the same day. Filler is more immediate, so you definitely see changes while we're doing the treatment. It's going to take a few days more for the swelling and bruising to start to resolve, but you'll walk out seeing the changes of the filler. And then another question about the best filler for the lower face that might help with jowling. That really depends on what's going on. So if there's an opportunity to support some of the tissue with filler along the cheeks and in the temples, that can provide some lift and support for the jowls, which is a good place to start. Sometimes filler along the jaw can be helpful, in the chin. Again, with here, you're from the zygomatic arch, you're getting some support and lift. And then in the chin, you'll tend to get some extension, which can provide improvement of this line in just a little different direction. You can also get some support back through with placement of filler back along the jawbone as well. And it depends on what exactly we're treating as to which filler we want to use and the amount that we're using for that. And then how does Juvéderm compare to Botox and other fillers? So Botox is not a filler. Juvéderm is a filler product made by the same company that produces Botox. Botox helps with dynamic wrinkles like the lines in the glabella area between our eyebrows, on our forehead, around our eyes, whereas filler is more about providing support to lift tissue. And then can the fillers help with the sagging jowls? And yes, they can. Again, our natural aging process is that we lose some support along our cheekbones. The mandible loses some support as well. There's less definition along the posterior angle of the mandible and less projection along the chin. So supporting those areas and restoring some of that volume that we've lost can help support that tissue and lift it. And then another question about Juvéderm in the lips. Does it have the same deadening effect such as Botox lip flip? It does not. It is not a product that affects the muscle movement, provided that you don't have too much filler in the lips. It should be very seamless and once everything's healed. And then does exercising shorten the length of time the results could last? It's not going to have a dramatic effect. People metabolize these products at different rates. So I've seen people that are fast metabolizers, and many times that doesn't have anything to do with exercise. So it really depends. If you're doing an extreme amount of exercise, it may play a role in how you metabolize things. I think probably hydration is going to be play a bigger role in maintaining the effect. And then, is it safe to get Voluma to boost my cheeks at age 33? And it is a safe product. It's very well tolerated. Again, the hyaluronic acid is a product that our own bodies make. And so it tends to be very well tolerated, and there's very few reactions. You do have to be a little careful when you start getting fillers at a younger age to keep the quantities that you're getting over time reasonable, so that you don't end up with an overaccumulation and too much filler in the face. And then can fillers build on hollow cheeks? And yes, they're definitely indicated for that, to help build up the cheeks. And there's a question about reversing the filler if the effect was not what was expected. We do have hyaluronidase available if someone wants to remove their filler, and that can definitely be used to reverse the effect. And then there's a question about under eye filler. Would that actually help the under eye color? So it helps with hollowness and providing some lift. So if there's shadowing from the hollowness, that it can help with the appearance of pigment there. But if there's truly pigment, filler does not correct pigment. And when you get too much filler in the under eye area, it absorbs more water to itself. And related to how thin that skin is, it can cause the appearance of some discoloration in that area as well. So you do have to be a little careful with the amount that's placed in the under eye. And then there's a comment that the QA is choppy, and we will reach out to you about that. So I apologize. And then, how long does lip filler last? Lip filler can last 6 months to a year, sometimes longer. It varies from person to person. And it can be started FDA approved, age 21 and up, and very reasonable to use in all those age groups. And then there's a question about laser treatments and how long to wait before getting filler. So after a laser treatment, you want to make sure that your skin is pretty well healed. Probably you shouldn't be in the real irritated stage after laser. You should give it a couple weeks after laser to get treated. And I think let's see here. I have a couple more. Is there a way to tell if there is still filler remaining? Or is time the only way to be positive that it is gone? It depends. If you know where it is, you can tell with ultrasound that there's still an increased fluid presence in that area. You kind of have to know where it was placed, though, to really have certainty that so that you know what you're looking for, essentially. And then I have a question about filler for periorbital lines. So I'm assuming this is regarding the crow's feet. Oftentimes, Botox is the best place to start with that. Botox, by reducing the amount of movement in that area, helps improve the crow's feet quite dramatically. But you can also do filler across those lines to provide some additional improvement. Um, And then how often can you get filler? Um, it's common that people will get touch-ups on their filler once or twice a year. They can get it more frequently than that, but most commonly once or twice a year is going to be good. And then are the results the same or better as Botox for the lines on the upper lip? And nasolabial folds. Botox is really not for treatment of the nasolabial folds. There are occasionally patients that can benefit from Botox for that area, but for many people, it affects their smile in a way that they don't really love. It Fillers work very well for the nasolabial folds, especially when combined with fillers in the cheeks. And the combination of filler and Botox for the perioral lines is certainly a wonderful option. It provides a nice alternative to more aggressive laser treatment for that area. And then I have a question about what is recommended for a downward smile. So sometimes a little bit of Botox for the muscles that pull down on the corners of the mouth can be helpful, as well as filler to just support the corner of the mouth. Those are both very effective approaches to treating that. And then I have a question about if I do not need a full syringe, we do offer half syringes. And the pricing on those starts at $400. And then there's a question about if you should wait until cheek filler dissolves completely for touch-up. You do not need to wait for it to dissolve completely. It reaches a peak effect with the treatment, and once all the swelling has resolved, and then it just kind of the effect gradually tapers off. So where people tend to be most satisfied is when they're doing some intermittent touch-ups along the way. It also helps stabilize the product that's still in there, which provides better duration over time. And then there's a question about whether there are certain products that would be more appropriate for different ethnicities. And really, these are products that are utilized equally in all ethnicities. There's really not any product that I would say is more appropriate to a single ethnicity. And then as a reminder, you will get a text message, and please reply with the code word DERMA or DERM to be contacted for a consultation with our office. And then I have a question about if there's more than one syringe, can you do all at the same time, or do I need to wait between syringes? We do commonly inject more than one syringe in a visit. I don't inject more than one syringe in the lips in a single visit, typically just due to the swelling and the healing process. But in other areas of the face, if we're treating the cheeks or the jaw as well, we'll oftentimes do more than one syringe in a visit. And then there's a question about how many different injectors there are. There's, I believe, 5 injectors in the Houston office, and then we have 2 injectors here in San Antonio. And then a question about if filler is absorbed by the body. And yes, our bodies produce the enzyme hyaluronidase, which is the same enzyme that we use to dissolve fillers. Our bodies are always building and breaking down hyaluronic acid. So our bodies will gradually break down the HA, and the product is quite a bit slower than the hyaluronic acid that our bodies produce, though. And then there's a question about if an ultrasound is performed to locate filler, is there an additional charge? We do not charge additionally for using ultrasound during the treatment. Let's see here. And there's another question about whether you can get the earlobes injected. And the earlobes are definitely an area that many people really love with the fillers. We lose a lot of volume in our earlobes, and as we lose that volume, the support for the earrings it disappears, and so you start to see elongation of any piercings, and the earrings will tend to hang more. So yes, you can put filler in, and that can help. And then someone asked who I am. My name is Carrie. I'm sorry that you weren't here to watch the presentation. I'm one of the injectors here in San Antonio. And then there's a question about whether we can do injection the same day as the consultation. It really depends. Many times we can. We do offer virtual consultations. It depends on how many questions you have, whether there's going to be adequate time to still perform the treatment. And then I have another question about how long should one wait after a Botox and filler treatment to have an anti-aging treatment. It really depends on what you're doing. Botox, you would want to avoid any sort of energy-based treatments for probably a couple weeks afterwards. With filler, you want your bruising and swelling to be resolved, so also probably about 2 weeks before you do any other types of treatments. All right, well, I think that's all for tonight. If you have any questions and would like to come in for a consultation, we will be reaching out over the coming days. Thank you.